Yeah, it's coming.
Yeah, it is just setting up in a minute. I mean, less than 5 seconds. Correct. So we are live on YouTube, and Shilpa madam, you can start.
So I welcome all of you to another masterclass series. So this session is slightly different because this is not a clinical session. It's more about the andrology. And I'm very pleased to inform all of you that Dr. Jay has been a traveling embryologist and also a very, very sought after embryologist in his initial years of practice. And people thought he was only an embryologist. Nobody thought he was a gynecologist. But then I think he was doing wonders with his embryology work, and he has immense experience in the same. So he will be teaching us as to how to process the semen for IUI, which is a very, very basic thing for people who want to set up their IUI setups, and also because of the ERT rules and regulations, wherein we can't have the processed semen from somewhere else and do the IUI in our clinics. So I think we should know this as a basic stuff, especially for people who are practicing in remote areas where finding the right person to do all this andrology work may be tough. So I invite Dr. Jay for this session. So over to you, sir.
Okay. So we will start off with the screen sharing. And Shilpa madam, you can see my screen, right?
Yes, yes.
Okay. Fine. So today's session is a very important thing on semen preparation for IUI. Okay. Now, I think whenever you do these things, whenever you do semen preparation for IUI, first you must try and understand what is the actual semen consisting of, right? So semen has a small portion of sperms. It has a lot of portion coming in from the seminal vesicles. It has a lot of portion coming in from the prostatic fluid. It has debris. It has all the enzymes. So, you know what typically happens whenever there is ejaculation. I'll just show this because this is the basis of doing IUI, okay? So for demonstration purposes, I'm just drawing a vagina, okay? And this is how the uterus is going to be present. And while having intercourse, the male partner, okay, is going to ejaculate a coagulum of semen, typically in the posterior fornix. Whenever this happens, please understand approximately 70 to 80% of this semen will just spill out. Okay. This coagulum, now, after a little while, will undergo something called as liquefaction. Okay. This liquefaction is actually the work of prostatic enzymes. Okay. I'll take a detailed session on semen liquefaction, but just remember, it is actually going to happen from the prostatic fluid. It releases these chemicals, proteases, and all these things, and it allows for liquefaction to happen. Otherwise, you know what typically happens if I draw the microstructure of a ejaculated sperm sample. It is a coagulum like this, and inside these coagulums are trapped our poor sperms, you know. So this coagulum undergoes liquefaction, and then the sperms would proceed in their journey upwards, okay, towards the fallopian tubes. All right. Now, what causes sperm to proceed upwards? We all know it is due to the progressive motility of the sperms, and a lot of role inside that is played by the seminal vesicle fluid. Okay, so just keep that in mind. Please remember, it also has a lot of debris. It also has a lot of enzymes, but nature has provided something which is extremely important, and that is something called as cervical mucus. And it is this cervical mucus which takes care of the debris, which take care of the enzymes. So actually the sperms which go inside the female uterus in a normal thing, okay, in a normal intercourse, is washed sperms. Okay, these are actually washed sperms. Who has washed them? Nature. Cervical mucus has washed close to 85 to 90% of them. Vaginal fluid and vaginal bacteria. Okay, so we can just call it as vaginal microbiome. And this vaginal microbiome has given another 10 to 15% washing. Please remember, these two words are very, very important, because these days a lot of people who don't know anything want to focus on vaginal microbiome without understanding that it contributes only 10 to 15%. But yes, this makes the role of probiotics and a healthy vagina very, very important in reproductive medicine, in IUI as well as in IVF cycle. So this is the basis for that entire thing. But the husband's sperms are washed by the cervical mucus, and after that, when they enter inside the uterus, they undergo activation, acrosomal reaction, and after all those things happen, after that there is going to be fertilization. Okay, so these three procedures, okay, and the procedure of washing of sperms, you want to achieve when you are doing IUI, because in IUI you want to inseminate directly inside the cavity. You cannot have debris going inside the cavity, you cannot have enzymes going inside the cavity, you cannot have any other materials going inside the cavity apart from sperms. And obviously with the sperms you need something which is similar to the fluid in the fallopian tube. This is your media, HTF media. It is actually a tubal fluid media. I will come to the media a little later. Okay, this is your basis of doing the entire IUI. Correct, Shilpa madam? Everything is clear till now, whatever I have drawn?
Yes, very clear.
Okay, now your entire purpose is to take out the debris. Your entire purpose is to take out the enzymes, as a result of which, if your semen washing has gone wrong, your patient post IUI is going to encounter uterine contractions. She is going to have pain. This uterine contractions is going to reduce the success rate of your IUI. And then you are going to tell the patient, don't worry, you have cyclopam. When you have cyclopam, uterine contractions will go off. But no, uterus is a very powerful thing. It will take out those enzymes, and simultaneously it will take out the sperm. Simultaneously it will throw out the embryo also if it is formed, because it increases the speed of peristalsis. As a result of which, if you want good results with IUI, the most important lecture is lecture on semen preparation. Okay, now I know we are all very, very busy gynacs. We have no time for anything in life. Okay, and when we have no time for anything in life, I'll just clear this diagram. Okay, so that I can draw a new diagram for everyone. Because we are so busy, we have no time in life, we appoint staff, okay, in order to do the IUIs and do the andrology. We appoint andrology technicians. The biggest mistake which we do when we want to do IUI, now we'll come to the main part, is in doing the semen collection. Okay, this is the biggest mistake which we do. Remember, semen collection is the most important thing, because this gives you a good volume of the sample. And as long as you have a good volume sample, you are going to get a good final total sperm motile concentrate. Okay, this is important for people to understand. As a result of this, keep the males comfortable, have a dedicated room for collecting of semen. Ensure that if you think the male is going to be someone, who is not going to be comfortable, always have a backup of frozen sperms with you. Okay, the result of frozen sperms is very, very good as far as IUI is concerned. Okay, there is no role of abstinence in these samples. You can have a sample even without an abstinence, and it is absolutely fine. As discussed in our previous lecture, it is mandatory that at least in my place, we will do a CASA, that is computer assisted semen analysis, and we'll do a DNA fragmentation index for all patients who are undergoing IUI, and that is absolutely mandatory. Okay, we are going to also discuss what techniques we are going to use for sperm washing. Okay, because that is very, very important. Everybody wants to hear that. So semen collection should always be done in a wide container. Just keep that in mind. It's a standard sterile container which is available like this. Okay, but the trick is a lot of people don't understand that even if you ask the guy to not have abstinence, please ask him to clean external genitals and cum. External genitals of the male has to be cleaned. You have to give this instruction specifically by retracting the foreskin and cleaning it. Retract the foreskin and clean it at least for 3 to 4 days. When you do that, you don't need to apply any betadine, fetadine, just normal water, saline, okay, normal jet spray over it. And if you clean it properly, it will any which will reduce the debris. Okay, so just keep that in mind. This small practical tip will automatically make your swim up and density gradient results very, very effective. Okay, so let's assume the male has collected the sperms. It has formed a coagulum. He has ejaculated approximately 2 ml of sample here and he has given it to you. Allow this sample to liquefy at 37 degrees centigrade for approximately 30 minutes. Okay, I know that the standard thing is 20 minutes, but 30 minutes is okay. Now, once it has undergone liquefaction, you need to prepare this sperm sample. Preparation, everybody is going to be interested in 2 methods. So I'll just draw those 2 methods. One is the swim up technique, other is the density gradient. I will tell you that I use swim up for 99% of the cases. Density gradient is used by me only if the patient has requested for doing a offbeat IUI. So what is an offbeat IUI? I'll just tell you my criteria. Sperm count is less than 10 million. DNA fragmentation is more than 20%. Okay. And morphology is less than 5%. Okay. These are my only criteria. So if all these criteria is getting satisfied, then I will use density gradient. For everything else, I will be using the swim up. Okay. So a lot of people would say, you want better quality sperms, you should use density, and you want this, then you should use this. By the end of this 15 minutes. Hello, can you hear me?
Yeah.
Am I audible?
Yes.
Okay, fine. So by the end of this 15 minutes, things will be clear. Okay, so just remember, the tube in which you are supposed to process is not a round tube, it is a conical tube. The reason why it is a conical tube, mandatorily, the reason why it is a conical tube is because you want the pellet to be visible and you want the pellet to form here. Okay, this is important for you to understand. How do you do this? You take 1 ml of sperm sample. So I'll just draw that. You take 1 ml of sperm sample plus 1 ml of HDM. You can even take IVF media here. Anything is okay, as everybody contains the same. The advantage with IVF media is that the IVF media also contain additional pyruvate. Okay, IVF media would also contain additional pyruvate, and this pyruvate will help the oocyte inside, not the sperm. Okay, so you can use that as well. 1 ml plus 1 ml, you can have 2-3 such tubes and you can centrifuge them. Okay, it is important that you have a very good centrifuge, not a time pass centrifuge. A good centrifuge, automatic centrifuge is important. It is good to do centrifugation at 2000 revolution per minute for approximately 20 minutes. This is the standard. Do not change your standards based on what you listen from one conference. Okay, keep it standardized. Your staff should be able to do it. Once you are able to centrifuge, you know what is centrifugation? You know what centrifugation does? Centrifugation is a very simple thing. The force is applied in the downward direction. So anybody who is heavier is going to be pushed downwards. That is why sperm, because the sperm contains, what does the sperm contain? I'm sure we have forgotten this, but I'll just revise some physics as well. The sperm actually contains something called as nucleus, and it has very, very little cytoplasm. Okay, and then it has mitochondria. So because the sperm contains so much of the heaviness inside the nucleus, okay, the sperm will go down. Because the RBCs contain nucleus, they will go down. Because WBC contains the nucleus, they will go down. Because the debris is multicellular, that will also go down. As a result of which, this what you have put down in the form of a pellet, okay, is going to be a mixture of all these things. It is going to be sperm plus WBC plus debris. Then what do you do in the second step? Second step is very simple. Once you have got the pellet, you remove the supernatant and you do an overlay with fresh media. So this is going to be your pellet here. This is going to be your pellet here, and you overlay this pellet with fresh media. Okay, you have overlaid it with fresh media. You can again do a 2 ml overlay. It is really up to you. So let's say you do a 2 ml overlay. This is what I do. I know there are people who say 4 ml. I'll come to 2 ml. That why 2 ml and why not 4 ml in a little while. Okay. And then what do? You tilt this tube. So what does it do? It increases the surface area of the things on the top. And you push this in the incubator. You put it in the standard incubator and you are supposed to incubate this pellet for approximately 1 hour. 37 degrees centigrade, CO2 6%. Basics. What will this do? Automatic sperms which are motile will start going up. I am very motile. I want to come out of this pellet because pellet is a very tough thing. So everybody wants to come out. So all the motile sperms will come out. All the debris will stay down. And if you do a good swimmer at this thing in an IVF media or an IUI media, at this layer, at the layer in the top here, this top 0.2 ml layer here, you will have super motile sperms. These are going to be most motile sperms. They may not be the most morphologically normal sperms, but they are going to be most motile sperms. Okay. Active, very fast. We have seen these videos and we all become very happy. Array, very good. It is like that. After you do this, you aspirate this in an IUI catheter. You just load it in an IUI catheter. And normally what we transfer is approximately 0.5 to 0.7 ml of the aliquot of the prepared sperms. You can use the swim up technique for every sperm which is available. You can use the swim up technique even for preparing the sperm for IVF. You can use the swim up technique even for preparing the sperm for IUI, even for doing ICSI. The basis why you are doing this is, please try and understand. Just like how the native sample has lot of enzymes, okay, these sperms, this debris, which you are talking about, this debris, all these WBCs, all these people release a lot of reactive oxidative species. Okay, so as a result of it, this normal sperm, it cannot cope up with it. As a result of which, you need the sperms to be free from them. Only if they are free, they can use their energy to go and fertilize the oocyte. Understanding? If they have to go and fight the reactive oxygen species, their energy goes in fighting with the reactive oxygen species. Fertility ka kaam hota hai baaju mein. As a result of which, it is important that DNA fragmentation is studied very nicely, because if the DNA fragmentation is grossly abnormal, even if you have a washed sperm, okay, that sperm has no energy to go and fertilize. These are the basics. You must keep this in mind. Okay. We will go ahead and I will show you what happens in density gradient. Okay. It's a very simple thing in density gradient. I hope people are able to follow my diagrams. Shilpa madam, diagrams are good enough?
Yes, very good.
Okay. So I'll just show you what happens in density gradient. Density gradient to isse bhi easy hai. Okay, density gradient is nothing. You don't have to do, don't even have to apply your head in density gradient. So we'll just show you what is that. Okay. See, in density gradient, the first and foremost important thing is, when you have a tube here, when you have a tube here, you are supposed to first layer the tube with 80% gradient. Okay, what is 80% gradient? Do you know? It's very simple. I'll teach you how to make the gradient when you don't have a commercial gradient media available. Okay, I do it very routinely, because when I was traveling as an IVF consultant, as an embryologist, sorry, I'll have to share the screen again. When I was traveling as a traveling embryologist, the beauty was we never had so much commercially available things in the interior. So what do you take? You take human tubal fluid. Let's say you have taken 8 ml of this fluid. Just add isotonic saline, or just add sterile water, no problem, sterile saline to this, okay, 2 ml. So ye ban gaya 80%. You want to make it 40%, no problem. Take HTF 4 ml, take sterile saline 6 ml, ban gaya 40%. So you have your media ready without even buying the commercial media. Don't think that the commercial media which is available from Mars, okay? Chandrayaan is not sent on the moon to collect commercial media for all these things. They also prepare it locally. They just package it nicely. Just because nobody knows, everybody thinks, "Haila, kya great cheese hai." After this lecture, I think 50% people will stop buying it. Okay. This is 80% locally prepared. This is 40% locally prepared. And on top of it, you just overlay the sperms. Either. How much sperm? Let's say if you have taken this as 2 ml, this as 2 ml, just remember the standard, then this should be 0.5 ml, 1/4 quantity. Okay, 0.5 ml sperms. अब ये करने के बाद में you just put it on centrifuge again. How much to centrifuge? 2000 rpm for 20 minutes. What will happen is, in order to clear a particular gradient, see from here, because it is only 40% gradient, a lot of people will be able to clear this. When from 40% it becomes 80%, out of these guys, okay, the poor morphology guys, there will be problems in clearing the gradient because it requires a lot of energy to clear. Abnormal DNA fragmentation will require a lot of energy to clear. So the pellet which is formed at the end of this is actually going to be you would have noticed this. If not, start noticing it from tomorrow. It is going to be a smaller pellet. Okay. This smaller pellet is actually going to contain the best sperms out of the lot. But because the sperm has spent a lot of energy, okay, in clearing the gradient, okay, after you incubate this, and after, let's say you have incubated for 1 hour and you do an IUI, you have to be very careful of this time because the sperm will lose out on a lot of other energy. Okay, that is why density gradient to be preserved only for special circumstances, where I know ki baba, in this situation, even if I do swim up, result is good, but after swim up has failed for 2 to 3 times, the next 2 to 3 times you can do it on a density gradient. Okay, so just keep that in mind. Otherwise it is so easy to prepare and it is so easy to do that you don't have to worry. One small tip which I want to give you, just in case anybody is getting some inspiration from this lecture and wants to do one semen preparation on their own. Okay, see, never ever, okay, you should never allow the sperm to mix directly with the media. As a result of which, we always tell people that, let's say you have a tube here, okay, and you have put, let's say you put some HTF media downstairs, okay, or let's say you have a pellet. Let's reverse it. Let's say you have a pellet and you want to put media with your dropper. You take your dropper here and you put the media at this wall. Okay, you put the media at this wall and let the media trickle over this. If you directly put drops here, this pellet will get distorted and the entire pellet will again become like a normal sample. So that is something which you have to avoid. A lot of people make this mistake and say, "Kyare sir, I did swim up, but I'm not able to get good sperms." You are not able to get good sperms because of this common mistake. I think I would have taught this to more than 150 embryologists so far. And after that, though there is no RCT on it and though there is no publication, people have started to get extremely good results. Okay. I will stop the sharing of the screen and I will come back to the session so that after this basic presentation, if there is something more which people want to understand, definitely there are 2 more things which I want to tell. The temperature in which the media is to be stored otherwise is 2 to 8 degrees. And before using any media for anything, get into a practical habit of incubating the media at least for 1 to 2 hours. This incubation of the media for 1 to 2 hours allows the CO2 to perfuse inside the media And whenever CO2 perfuses inside the media, it enhances the capacity of the media to absorb the free radicals. Okay, that is because CO2 helps in producing bicarbonate inside, and this bicarbonate will go and bind to the free radicals, and it will allow your sperms to do their job for fertilization in a much better manner. So keep that in mind, because a lot of people don't know this, and a lot of people just take out the media and start using it, and the sperm will immediately die if it is exposed to a temperature of less than 15 degrees. Okay, so keep that in mind. But yes, with this, I think I can now answer questions for of Dr. Shilpa. I'm sure she has, made 2-3 embryologists wear some jackets and stand beside her since morning to teach her so that she can ask me questions. But yes, Shilpa madam, you can go ahead, and I think I shall be happy to answer.
So if there is infection in the semen sample, so how do you tackle?
See, 80% of the infections, actually when you are looking at infections, you are looking at the pus cells. Okay. Otherwise, please remember, a patient who is ejaculating will have pain while ejaculating if it is a genuine infection. So most of these pus cells are going to come from the local infections like balanitis or posthitis. What you simply need to do is ask the guy to retract the foreskin. Ask to retract the foreskin, wash it with normal saline for 3 to 5 days. The minute it does that, your pus cells from 20 will come down to 2. Okay. But let's assume you are very, very serious about it and somebody is telling you, no, sir, I have pain while ejaculation. Correct. In that situation, irrespective of the pus cells, do semen culture. How to do semen culture? Most of the people don't know. Semen culture is done by giving a masturbated sample and then taking the next urine sample. Okay, a masturbated sample with the urine sample, and you are supposed to culture the semen with the urine. Okay, so the urine culture is to be done in a separate plate, semen culture is to be done in a separate plate, both have to be incubated. If you incubate the semen sample, it has to match with the organism in the urine. Okay, otherwise you will have all fancy organisms coming from the glans penis, depending on how sexually active the male is. Okay, you will have candida, clostridium difficile, all these things, but it has to match with the urine sample. Majority of the people like to give roxithromycin for 10 days 150 BD, which is absolutely nonsense. You should wait for the culture sensitivity report of the urine to come in, and then you should start antibiotics, and people will have a fantastic response.
I mean, levofloxacin also is not advisable. See,
In fact, levofloxacin and ciprofloxacin there is an advisory. I think some state committees have issued that reserve levofloxacin for MDR TB patients and don't use them randomly in treating stupid infections.
Yes. So within how many hours that the processing needs to be completed? So once the male gives the sample,
it will take, once the sample is ejaculated, it will take 2 to 3 hours to do the IUI.
Okay, but the starting of that wash and everything should be started immediately after liquefaction, because we see many patients or many embryologists who become busy inside. They will have only one person to do everything, so they leave it for liquefaction and go off. So within how many hours max you can do all this?
45 minutes of liquefaction.
Okay, and after the processing, within how many minutes you need to inseminate it into the uterus? Like, is it like 4 hours, 3 hours max to retain the
2 hours is a good window, madam. I mean, once you have incubated, we have a timer here, at least at our place, that once it is incubated, the patient, the female partner, okay, is told that, now you start drinking some water. Okay, so what typically happens is, once they start drinking water, bladder starts becoming little full and all these things. That takes approximately 60-80 minutes. Okay, by the time she comes on the IUI table, anywhere between 60 to 80 minutes is comfortable enough once the sample has been washed and kept inside the incubator.
Okay, so do you use simple wash technique at all in your place, or only simple wash should never be used according to you?
Simple wash, no. Why according to me? Simple wash has a lot of debris. Please understand. If you want to replicate nature, you have to remove the debris. You have to remove it. There is no other option which you have. Otherwise, uterus will have hypercontractility. Even if you give atosiban, it will have hypercontractility.
So the time taken between density gradient and swim up, which is lesser?
Oh, it's the same, madam. See, there are so many people who would do double wash, no? There are so many people who would first do a swim up and then they think that the pellet, see, with the best way to identify is if your pellet is formed, the media above that should be clear. If the media is appearing hazy, that means the entire pellet is not going to be containing sperms. You know, it is going to have a lot of sperms still inside that. Correct. So that is a very simple test to do. So some people do a double wash, some people do a single wash.
And do you do sequential, like you do density gradient and then do a swim up?
No.
Because
No.
never to be done.
It is too much for a sperm, yaar.
And if there is increased viscosity, so how do you prepare the semen?
See, the best thing, no, if you have to test the viscosity actually, after 30 minutes also, if there is no liquefaction, okay, then you know, one of the things which you can do is with the dropper which is there, no, if that strand of sperm which is forming, no, like otherwise it will not form any strand, you know, it will just drop down. Okay, that it will start forming strands. That is an indicator of hyperviscosity. Okay, so one of the things which you can do in hyperviscosity, which works very nicely on most of the patients, is to do something called as needle hunting. So you take a needle and just beat it, or take a media inside the needle, flush it. Okay, remove it, flush it, remove it. Do it 5 times and it will normally get liquefied. Okay, normally. You don't need to add Hylace. You don't need to do anything like that.
Okay. So in your setup, you use mostly IVF media for IUI?
I only use IVF media for IUI.
Okay.
I never order for a separate IUI media. Never.
Okay. And TMSC, I mean, would you like to comment on the minimum?
Best minimum is more than 1 to 2 million, to be very, very honest with you.
Okay. Okay. So,
but that is too less. See, in that 1 to 2 million, no, your results will not be so great. Your results is going to be occasional. Okay.
Right.
More than 6 to 7 million, fantastic results. More than 10 million, brilliant.
Okay. So what is your advice on home collection and bringing it to the lab?
I don't allow. I will take a backup sample. I will freeze it. The outcomes with frozen sperms are as good as fresh sperms.
Okay. So in the frozen sample, you thaw it and then you do it the same way as you do this fresh sample.
So we wash, we never wash the sample prior to freezing. Only after we thaw, we will wash. Always. We never put a washed sample in the cryocan.
Okay. So which is a good incubator? I think
I am using Heracell. People can use ESCO. People can use whatever, Thermo Fisher, whatever they want. Okay. Even Aztec is good.
Okay. So any special precautions in HBsAg positive males or?
No. Sorry. Nothing like that.
Okay. Okay. So I think the important thing is the basic sample quality is the most important determinant for the success of the IUI.
Yeah.
And
correct.
The semen preparation and all the other things that we do is just an add-on. The basic 7 parameters which are of utmost importance to determine the success rate.
So I'll tell you one thing. We have CASA inside our hospital. Okay. And we do pre-wash on CASA. I'm sorry. And we also do a post-wash on CASA. The best way to study if your embryologist is good is check the data at the end of the month of post-wash. Listen, a manual reporting can be a biased reading. CASA will never lie. If on CASA, the total progressive motility is more than 90%, okay, and your concentrate is more than 6 million, you will have very good outcomes.
Okay.
Yeah.
So, is CO2 incubator required for IUI?
Better to have. If you are using IVF media, then better to have.
Okay. So if the proper pellet is not formed, what could be the reason?
Improper mixing of the media.
Okay. And somebody is asking the cost of CASA mission.
About 20 lakhs.
Okay. Okay. Yeah. I think that's about it. It was excellent. Actually, it was very, very insightful what you explained with regard to density gradient and swim up. So a lot of centers still practice, I think, density gradient. It was very new for me to listen that you do only swim up for all your courses. So it was quite.
You can from tomorrow you can start preparing density gradient on your own. It is such a simple thing to prepare, as I showed.
Yeah.
There is no need to buy commercially available media for density gradient. No need. You want to prepare 90%, I'll prepare 90% in 2 minutes. You want to prepare 40, you tell me the percentage. You want to prepare 27.5, no problem, I'll prepare it that way. Okay, there are so many people who will have triple gradient. That is what is used in animals. In animals they use 30, 60, 90 triple gradient to wash the sperms. In order to do IVF, they never do ICSI. Majority of the animal embryos is with IVF. So they want the best of the best of the best sperms through the gradient, as a result of which, irrespective of the sample, okay, they'll immediately take the pellet, incubate for an hour and immediately do IVF, okay, in the animals. And that is a data which they extrapolated to humans, but not so great.
No, but this was very, very good. I mean, I think this was one of the best sessions so far that we have had. So thank you very much. I think you should take care and take some rest.